Stop. Before you skip this, I need you to answer one question honestly. When was the last time you woke up and your mouth did not feel like sandpaper? If you're struggling to remember, this video is for you. And what I'm about to tell you has shocked people who thought they were perfectly healthy. Most doctors won't connect these dots for you. I'm going to connect them right now. You open your eyes in the morning, and the very first sensation you feel, before gratitude, before your to-do list, before anything, is that your mouth is completely dry. Your tongue feels like sandpaper. Your lips are cracked. Your throat feels like you swallowed a fistful of dust while you were sleeping. And you immediately reach for water because you feel like you haven't had a single drop of liquid in days, even though you drank water right before bed. Here's what most people do next. They drink some water, brush their teeth, and completely forget about it. They tell themselves it's normal. They think everyone wakes up like that. They think it's just one of those things that happens when you sleep, and they move on with their day. Here's what I need you to understand right now. If you are waking up with a dry mouth on a regular basis, your body is not being dramatic. It is sending you a signal. And in over 2 decades of medical practice, I have seen patients come in for something completely routine. And when we dug deeper into that harmless, dry mouth, we found things that shocked them. Things that had been building silently for years. Things that, if caught earlier, could have been stopped. My name is Dr. Clarence Martin, and today I'm going to walk you through exactly what your body is trying to tell you, the science behind it, the hidden causes nobody talks about, and most importantly, what you can do starting tonight. Stay with me through the whole video because what I share toward the end, around cause number 5, has genuinely changed lives when people finally got the right diagnosis. And if this kind of real, science-backed health information is what you've been looking for, hit subscribe right now. New content every week, no fluff, just facts you can actually use. Before we get into the causes, I need to tell you something most people have completely wrong about saliva, because once you understand this, everything else clicks. Your mouth is supposed to produce saliva constantly, including while you sleep. Your salivary glands slow down during sleep, yes, but they should never shut down completely. And here's why that matters. Saliva is not just water. It is one of the most underappreciated protective fluids in your entire body. When saliva production drops significantly during sleep, your mouth becomes a breeding ground for damage. But here's the critical insight. The dry mouth itself is not the problem. The dry mouth is the messenger. It is your body's way of saying something deeper is going on, and that messenger is trying to get your attention before the real problem gets worse. The very first thing I check when a patient tells me they wake up with a dry mouth every morning is how they're breathing during sleep. The very first thing I check when a patient tells me they wake up with a dry mouth every morning is how they're breathing during sleep. If you breathe through your mouth while you sleep, constant airflow evaporates moisture from your oral tissues, and by morning, your mouth feels like a desert. That's just physics. But here's what you need to ask yourself. Why are you mouth breathing in the first place? Sometimes it's nasal congestion, allergies, a deviated septum, chronic sinusitis, but for millions of people, the reason is something far more serious. Obstructive sleep apnea. With obstructive sleep apnea, the tissues in the back of your throat collapse during sleep and partially or completely block your airway. Your body responds by opening your mouth wider to gasp for air. You might snore loudly, choke, wake repeatedly without ever remembering it. And in the morning, you wake exhausted despite 8 hours in bed, with a headache and a completely dry mouth. Untreated sleep apnea does not just make you tired. Every time your airway closes and your oxygen drops, your heart is forced to work harder. Blood pressure spikes. Stress hormones flood your body. Over time, this dramatically raises your risk of hypertension, heart attack, stroke, irregular heartbeat, and even sudden cardiac death. And it all began with a dry mouth you thought was nothing. A few years ago, a man in his early 50s came to see me for something completely unrelated. In our conversation, I asked how he sleeps. He mentioned he always wakes up with a dry mouth, and that his wife complains constantly about his snoring. I sent him for a sleep study. The results: moderate to severe obstructive sleep apnea. His oxygen levels were dropping dangerously low, multiple times every single hour, all night long. He had no idea. He thought he was a good sleeper. He thought the dry mouth was just because he forgot to drink enough water before bed. That one question about his dry mouth potentially saved his life. We caught it before it became a cardiovascular event. If you snore, wake up feeling exhausted despite a full night, or someone has told you that you gasp during sleep, please get a sleep study done. Home sleep studies are now widely available and surprisingly simple. CPAP therapy or oral appliances can be life-changing. Patients tell me it's like waking up for the first time in years. The second cause is one that people really don't want to hear, but I'd be doing you a disservice if I didn't say it clearly, and that is diabetes. When your blood sugar is consistently elevated, your body tries to flush out the excess glucose through your kidneys. This means you urinate far more frequently, a process called polyuria. More urination means more fluid loss. More fluid loss means dehydration. And one of the earliest and most noticeable signs of that dehydration? A dry mouth when you wake up. Here's what makes this dangerous. Type 2. Diabetes develops gradually, silently, for years. Many people have elevated blood sugar right now and have no idea. If your dry mouth is accompanied by any of these, getting up to use the bathroom multiple times a night, feeling excessively thirsty during the day, unusual fatigue, blurry vision, or tingling in your hands and feet, these are not separate, unrelated annoyances. These are a cluster of symptoms pointing at the same thing. If uncontrolled diabetes goes undetected long enough, the consequences are severe: kidney damage, nerve damage, vision loss, poor wound healing, cardiovascular disease. Every single one of these is preventable if you catch it early enough. The dry mouth might be the earliest clue your body is giving you. Don't ignore it. Get your fasting blood glucose and HbA1c tested, especially if you're over 40, overweight, or have a family history of diabetes. Prediabetes is largely reversible with the right lifestyle changes. Full diabetes is not. That simple blood test could change your entire health trajectory. The third cause affects a truly enormous number of people, and most of them have no idea. That's medication side effects. If you take any medication for blood pressure, depression, anxiety, allergies, pain, or dozens of other conditions, there is a very real chance that dry mouth is a listed side effect. Hundreds of commonly prescribed medications reduce saliva production. Antihistamines, some of the worst offenders, SSRIs and tricyclic antidepressants, known for significant salivary reduction. Diuretics for blood pressure, they deplete fluids throughout your entire body. Pain medications, muscle relaxants, anti-anxiety drugs, the list is long. I am not telling you to stop your medications. That would be dangerous. What I am telling you is, this is fixable. But here's the part that almost nobody talks about, and it genuinely concerns me as a physician. When dry mouth from medication goes unmanaged for months or years, the bacteria inside your mouth fundamentally change. The beneficial bacteria die off. The harmful bacteria that cause cavities and gum disease multiply rapidly. I have seen patients who had perfect dental health their entire lives suddenly develop rampant cavities in their 40s and 50s. When we traced it back, every single time, the common denominator was chronic dry mouth caused by a medication they had recently started. They thought the dentist was the problem. The medication was the problem. Gum disease doesn't stay in your mouth. Research has established strong direct links between chronic gum disease and heart disease, Alzheimer's disease, and worsening diabetes. A dry mouth from a medication isn't just uncomfortable. It can be the first link in a chain that reaches your heart and your brain. Write down every medication and supplement you take, including over-the-counter products. Bring that list to your next appointment and ask specifically about dry mouth as a side effect. Ask whether an alternative exists. Sometimes switching from one blood pressure drug to another completely resolves it, with zero change in effectiveness. The fourth cause sounds obvious: dehydration. But hear me out, because this is far more nuanced than most people realize. Most people believe they drink enough water. Most people are wrong. Coffee, tea, and alcohol are all diuretics. They cause your body to excrete more fluid than you take in. Exercise without adequate rehydration creates a deficit that persists into sleep. High sodium and processed food diets require more water to process. And if you sleep in a heated room in winter or air-conditioned room in summer, the dry air is literally pulling moisture from your airways and tissues all night long. Practical goal: drink at least half your body weight in ounces of water, spread across the day. If you weigh 180 pounds, aim for 90 ounces, not all at once and not right before bed. Cut back on caffeine and alcohol, especially in the hours before sleep, and consider adding a humidifier to your bedroom. Keeping humidity between 40 and 60% can make a dramatic difference in how you feel every single morning. Now we get to the cause that is becoming increasingly recognized, and the one I said might genuinely change some of your lives. This is an autoimmune condition called Sjogren's syndrome. Sjogren's is an autoimmune disease where your immune system mistakenly attacks the glands that produce moisture in your body, primarily your salivary glands and your tear glands. The result is persistent dry mouth and dry eyes, often alongside fatigue, joint pain, and skin dryness. It is significantly more common in women, often developing in the 40s or 50s, and many people go years without a correct diagnosis because they attribute it to aging or stress. If your dry mouth does not improve with more water, and your eyes feel persistently dry too, this needs to be investigated. Beyond quality of life, undiagnosed Sjogren's carries a modestly elevated risk of developing lymphoma over time. Early diagnosis and proper management can prevent dental decay, oral infections, and significantly improve daily functioning. A blood test and potentially a lip biopsy can confirm this diagnosis in your doctor's office. The sixth cause is something most doctors don't openly connect, and that's chronic stress and anxiety. When you're stressed, your sympathetic nervous system, your fight-or-flight system, activates. It redirects blood flow away from non-essential functions like digestion and saliva production toward your muscles and vital organs. If you go to bed with racing thoughts and unresolved anxiety, that system can remain activated throughout the night, suppressing saliva production for hours on end. Chronic stress also promotes shallow, mouth-based breathing that compounds dryness. Beyond the mouth, sustained high cortisol impairs your immune function, promotes abdominal weight gain, disrupts your deep sleep, and accelerates cellular aging. The dry mouth here is one symptom within a much larger physiological picture. I also want to quickly mention acid reflux, GERD, because it's under-recognized as a cause. Stomach acid traveling into the throat and mouth during sleep can directly damage oral tissues and disrupt saliva. If you wake up with a sour taste alongside dry mouth, GERD may be part of your story. A consistent pre-sleep routine, 10 minutes of deep breathing, gentle stretching, or journaling, actively shifts your nervous system from sympathetic to parasympathetic before sleep. If stress is chronic and pervasive, professional support isn't a luxury, it's a clinical recommendation. Let's talk about what you can actually do, because I don't believe in giving you problems without solutions. That's not how I practice medicine. So here are 7 specific actions, starting tonight. Get a sleep study done. If you snore, wake exhausted, or someone has witnessed you gasping, this is not optional. Ask your doctor about a home sleep study. CPAP therapy can literally transform your energy, your mood, your blood pressure, and yes, it eliminates the dry mouth completely. Test your blood sugar, fasting glucose, and HbA1c. Simple blood tests, especially if you're over 40 or have the accompanying symptoms I mentioned. Prediabetes caught early can be reversed. Once it becomes full diabetes, that window closes. Review your medications. Complete list, including over-the-counter. Ask your pharmacist or doctor specifically about dry mouth side effects. A simple switch is often all it takes. Don't assume you have to live with the side effect just because the underlying condition requires treatment. Hydrate strategically, not just at night. Half your body weight in ounces of water, distributed across the day. Add a bedroom humidifier. Cut caffeine and alcohol in the evening. These 3 changes together can transform your mornings. Practice nasal breathing during sleep. Nasal strips, positional changes, or medical-grade mouth tape after your doctor clears you can completely resolve dryness in straightforward mouth-breathing cases. Many people find this is the single most effective change they make. Actively protect your oral health. Use alcohol-free mouthwash. Alcohol worsens dryness. Fluoride toothpaste, daily floss, and consider an oral moisturizing gel at night. Chew sugar-free gum during the day to stimulate saliva, and see your dentist every 6 months, not every year, every 6 months. Address the stress at the root. A 10-minute bedtime wind-down routine is not a luxury, it is medicine. Deep breathing, journaling, gentle stretching. If anxiety is persistent and severe, seek professional support. Your mental health and your physical symptoms are not separate. They never were. Here's what I want to leave you with. Your body is one of the most intelligent systems ever created. It is constantly monitoring, adjusting, and trying to stay in balance. And when something goes wrong, it sends you signals. Sometimes those signals are loud and impossible to miss, chest pain, difficulty breathing. But sometimes they are quiet, subtle, easy to dismiss, like waking up every morning with a dry mouth. The people who live the longest, healthiest lives are the ones who learned to listen to those quiet signals, the ones who didn't brush it off, who asked the question, who investigated before a small problem became a large one. Don't be the person who finds out 5 years too late. Take this as your invitation to look deeper. Talk to your doctor, get the tests, make the changes. You may find it's something simple and easy to fix, or you may find something that, caught today, completely changes your health trajectory. Either way, you owe it to yourself to find out. Before you go, I want to hear from you. Leave a comment below right now. Do you wake up with a dry mouth in the morning? And after watching this, what do you think might be causing it? I read every single comment, and your answer might help someone else in this community recognize something they've been missing. If this video gave you something valuable, something you're going to act on, subscribe now and turn on notifications. Every week I put out content like this, science-backed, practical, designed to help you take real control of your health. This is Dr. Clarence Martin. Your health is your greatest asset. No symptom is too small to pay attention to. Take care of yourself, and I'll see you in the next video.